Welcome, everyone. Oh, we're self-air. Just kidding.
It said it was starting, so we'll see.
Yeah.
Welcome, everyone. My name is Sandra Flowers, and joining me today is Caitlin Fogel, Cynthia Scott, and Felicitas Kama. And today are in Uganda. So what is podoconiosis? It is a neglected tropical disease that's found in the highland areas of tropical Africa, Central America, and the Northwest India area. So according to the World Health Organization, it is found in these areas due to a combination of their high altitude, high seasonal rainfall, low income, and the volcanic irritant found in their villages. Podoconiosis develops in men and women who work barefoot in the irritant soil. Particles of silicate enter through the skin, and in people with a genetically determined abnormal inflammatory reaction, it creates irritation to the lymphatic system, causing lymphedema, or severe swelling of the foot and lower leg. The swelling can cause significant disfiguration, as you can see in the pictures there. And it also causes people to be unable to work. Affected individuals, due to stigmatization, are also unable to attend school, churches, community events, and are prevented from marrying unaffected individuals. We have decided to focus our intervention in the Kamwenji district of Western Uganda since, according to the American Journal of Tropical Medicine and Hygiene, there has been a recent increase in the number of cases in that district over the past 2 years. So how is it treated? For those who have the disease, we will follow a standard lymphedema treatment plan to help with the disease, in addition to teaching personal hygiene and the importance of wearing shoes to help prevent the disease in those who are unaffected. So there's an organization called the International Podoconiosis Initiative, also known as Footwork, and they've done extensive research on the use of the standard lymphedema treatment in addressing podoconiosis. And they found that it has a considerable impact both on the clinical progression of the disease, along with an improvement in the quality of life for affected individuals. This treatment plan also requires minimal resources, making it both cost-effective and sustainable. So the goals, next slide, please. So the goals of the treatment are to reduce the swelling, to increase their lymph drainage, to improve the skin conditions, relieve their discomfort, and improve the quality of their life. So a simple overview of the treatment plan would be to get them to wash their feet with soap and water on a daily basis, and then once a week soak in a diluted solution of bleach water as an antiseptic. Get them to use an emollient or lotions to help with the coarseness of their skin. They will elevate their feet at night and use compression bandaging to help reduce the swelling. And we'll also have them attend to any wounds that they have and also teach them lymphatic exercises to increase drainage. And we will teach them the importance of using shoes to help prevent further irritation. You're muted, Felicitas.
So we've been able to find out some educational resources for prevention. As we have learned, usually the biggest barrier in implementing any health initiative is in trying to change behaviors in the target population. This is especially true in preventing podoconiosis. Simply wearing shoes can effectively prevent this disease. There are many reasons why people don't wear shoes, which include both economical and cultural factors. Our initiative will train local people to facilitate meetings that will educate the target population on the importance of wearing shoes. Using local people to conduct the classes will help ensure that they are culturally appropriate, and acceptable. The educational materials will be based on the health belief model, which aims to change their attitudes towards wearing shoes by increasing their awareness of their susceptibility and also the severity of the disease. The classes will also seek to empower them to take actions to protect themselves. The International Podoconiosis Initiative has developed educational materials that they currently use in Ethiopia. We will partner with this organization and use their research-based curriculum.
Shoes. This initiative is going to be possible thanks to the collaboration of TOMS. Currently, TOMS is supporting the distribution of shoes in the areas of Ethiopia to prevent more people to get infected with podoconiosis and by improving the life of those who are suffering already from the disease. At the same time, TOMS is generating jobs by creating the shoes in the same area, helping also the economy in the area. With this initiative, we are planning to make a significant impact in the affected population of Uganda. TOMS founder and chief show giver Blake Mykowski decided TOMS would take on podoconiosis as a personal cause. Our alliance with this company will improve our project because they already have experience with this disease. Our goal is to develop a similar program in Uganda. How they can obtain shoes. Every person in the town will have the possibility to obtain a pair of shoes. Our goal is to make the cost of the shoes accessible for the population. In addition, they will receive a 10% coupon for assisting and participate in the educational program. For this initiative, it's important that the people show a real interest in improving their health. We believe that if we give them shoes without any cost, they will not be compromised with the mission and our initiative will be not successful.
So how will we fund our project? We will be holding a 5K race in Salt Lake City, Utah, as a fundraiser to help raise money for education promotion and help in getting these shoes. 100% of the proceeds will go towards our project. We have had many generous donors who have donated all of the food and water for the race, as well as the awards. We will have local hospitals and police there to help in first aid and in directing traffic. Our event will also feature David Archuleta, who has agreed to hold a concert for the benefit. Those that pay to run the race will get into the benefit concert for free, and the outside public can pay a small fee to get in. So some barriers that we found when we were working on our project is cost prohibited to ship the shoes to Uganda. Two, bringing shoes sourced outside of Uganda would have a negative economic impact on the community, especially on local shoemakers. And three, we need to find a way to have the money up front to start the process of designing and creating the 5K t-shirts before registration fees come to offset the costs. So to overcome these barriers, instead of shipping shoes, we will manufacture the shoes in the same area to avoid these costs. With the help of Tom's shoe company, we will be able to develop a program that will generate jobs while helping people to have easy access to the shoes. And to help with the upfront costs, we will offer all donors that donate $250 or more to have their company on the race t-shirt. This will provide great advertisement and it will make the donors feel like it is worth donating to our cause.
So concerns other organizations might have in implementing our intervention in other areas of the world, such as Central America or Northwest India, where podoconiosis is an issue. Their biggest concern would likely be to ensure that the educational materials are culturally and geographically appropriate so that they're relevant to the target audience. The cause for not wearing shoes could vary and would therefore need to be dressed accordingly. The other concern the group would have would be to find the best way to get shoes to the people at risk who need them. They would need to discover what shoes are currently available in that region and then work with that source to create the specially designed footwear for those that are already suffering from the disease, and also find a way to expand the number of shoes that are available to those who still need them. They would need to be concerned with finding a way to get shoes to those who need them without disrupting the local shoemakers and in a way that supports or even builds the local economy. Felicitas.
While podoconiosis is a neglect tropical disease that disfigures and disables 14 million people worldwide, it is entirely preventable. Even better, nothing new needs to be invented to prevent it. The key to reducing the disease doesn't lie in creating better shoes, but in changing attitudes and behaviors toward wearing shoes while increasing access to shoes in a way that the target populations embrace and can take over ownership, and this together is our goal. Thank you so much for your time.